coming, but he's not playing today.
Good with that. Good morning. The Committee on Insurance and Financial Services shall come to order. Mr. Clerk, will you please call the roll to establish quorum?
Representatives Carter.
Yes.
McFall.
Here.
Coleman.
Here.
Stone.
Here.
Breen. Rogers. Scott.
Present.
Young.
Here.
Fitzgerald.
Here.
Grant.
Here.
Harris.
Here.
Markkinen.
Here.
Bazat. Aragona.
Here.
Bruck.
Present.
Nyer.
Here.
Smith.
Present.
Madam Chair, you have a quorum.
Thank you. We need a motion to adopt the minutes of June 20th, 2023. Representative Scott moves to adopt the minutes as printed. Hearing no objections, the minutes are adopted as printed. Well, first on our agenda is a presentation by Delta Dental and Delta Dental Foundation. Here today are Rick Lance, Vice President and Chief Lobbyist of Delta Dental of Michigan, Ohio, Indiana, and Dr. Holly Seabury, Executive Director of Delta Dental Foundation. Thank you for coming. The floor is yours.
Thank you, Madam Chair. We appreciate the opportunity very much to share a little bit of information about Delta Dental, talk about some unique features of the dental insurance industry, and then a little bit about our work across the state in trying to improve access to care in a variety of ways. So I'll start off here and with just a quick thumbnail history of Delta Dental. We're a little over 60 years old, headquartered in Okemos, just east of here a bit. We have about 1,300 employees and contractors. Our Okemos headquarters is also the headquarters for the Delta Dental plans of Ohio and Indiana. The Delta Dental system is a little bit unique. We're a collection of 39 different and independent companies bound together by a shared mission and shared resources. We are collectively the nation's largest provider of dental coverage. Couple quick facts that we're proud of. Almost 90% of Michigan dentists participate with Delta Dental, which we believe is an indicator that we have a good relationship with the profession and ensure fair reimbursement and other benefits to their practices. We recently achieved High Trust certification, which is quickly becoming the gold standard in third-party validation of your security system, the means by which you protect protected health information. We are the largest administrator of MDHHS's Healthy Kids Dental Children's Medicaid program. We have about 800,000 enrollees in that program. We partner with several of the Medicaid health plans to administer adult dental benefits as well. And we partner with some Medicare Advantage health plans to offer dental benefits to seniors too. So a little bit about the industry, and we'll start with who purchases dental coverage. I think we're all probably most familiar with the fact that employers are the biggest purchaser of dental coverage for their employees as a means of attracting, retaining employees, and keeping them healthy. But there are several other types of purchasers, and I won't run through all of these in this presentation, but I think it's important to point out a couple that individuals and families can purchase dental coverage on their own if they don't have it through an employer. They can purchase that in the open market or through a federal or state exchange. Retirees are often interested in purchasing dental coverage because if you're in traditional Medicare upon retirement, there is no Medicare dental benefit. Often the Medicare Advantage plans will throw in a Medicare dental benefit as a means of attracting enrollees, but in traditional Medicare, there is no dental benefit. And then trusts, which are often an entity that organized labor uses to purchase benefits, is also a common purchaser of dental benefits too. So like the healthcare industry, our clients are either fully insured or self-insured. A fully insured client is kind of that traditional purchasing mechanism that we think of when we purchase coverage individually. You're paying a premium to a carrier, and that carrier is taking on the risk for your claims. Larger groups are typically self-insured, where they are just paying a carrier to administer benefits, but they are paying the claims costs themselves, and they bear the risk for claims. So a quick note on the types of dental services covered under a dental plan. Really, it runs the gamut, but I would just point out on this slide that dental coverage is, I would argue, the original preventive model. You may know from your own dental benefits that there's an emphasis and greater benefit for those preventive and diagnostic services. Usually they're covered at 90 or 100% with no or minimal out-of-pocket expense for the patient. That is very much on purpose, designed to ensure that people get to see the dentist regularly, typically 2 times a year, and get in there for that preventive care and early diagnostic care to help prevent problems, but if they exist, help identify them early. And then, of course, there are benefits for more major services too, and some employers also provide orthodontic services or braces, typically for younger people, but that is changing a bit. So a quick note on what makes up a dental premium, right? You get, if any of you have ever purchased dental coverage individually, you may wonder what all goes into this monthly premium that I'm paying. And it's a complicated calculation, as insurance always is. But I've got a list here of kind of the factors in that equation. And I would just point out some of the bigger ones: dentist reimbursement, how much a dental plan is paying their dentists to provide care. That varies by plan. The benefit design is, of course, an important one. How much is the patient responsible for paying on their own? Dental plans typically have an annual maximum benefit of somewhere between $1,000 and $1,500, so that variance there can be a factor too. But as with anything, it's something that actuaries get pretty good at determining what the premium needs to be. I would just note here that dental premium is typically about 10% of health coverage premium. So we work with a much smaller dollar amount to administer dental benefits than a health plan does. So a slide here on the importance of dental coverage. So going back to my comments about encouraging preventive care, families with dental insurance are almost twice as likely to get preventive care if they have dental coverage as opposed to not having dental coverage. So it really makes a difference in terms of getting people in for that routine preventive care. And then people who do develop a complicated dental problem are more likely to skip their treatment if they don't have some sort of dental coverage to help cover those costs. And that quickly becomes a downward spiral. Untreated oral disease, especially more complicated ones, result in 2.1 million emergency room visits nationwide every year. And you can imagine that an emergency room is really the wrong place to try to receive dental care for a variety of reasons. One, they typically don't have dentists, so you're often just receiving an antibiotic and pain medication and told you need to go find a dentist. And it's obviously the most expensive place to try to receive dental care. So to the degree that we can get people going to the dentist instead of emergency rooms, that will save our whole healthcare system money and make sure people get the care that they need. Just a quick note on the savings associated savings for families if they have dental coverage. If you're paying out of pocket with no dental coverage for care, and you have a family of 4, you could be looking at a figure of about $2,200 a year for preventive visits and typical fillings, right? Obviously, you have no premium expense in that equation, but if you take that same family and they're paying annual premiums of about $1,200 and they still need some fillings, they're experiencing a savings of $800 after those premiums have been paid. So, and then lastly for me, and then I'll turn it over to Dr. Seabury, we now know that there are identified and proven connections between poor oral health, and typically gum disease is the biggest culprit, and poor overall health. And you see a list here of some of those connections that have been proven, but we learn more and more about this every year, and some of the big ones, diabetes. We know that someone with gum disease and diabetes has a harder time controlling their blood sugar levels. Heart disease is another big one too. Obviously, if you know anyone who's ever had a joint replacement or an organ transplant, you need to be healthy dentally before you can have those procedures done. So I think the importance of dental care is just being proven over and over again. And then, so Delta Dental's mission is to improve oral health, right? And that is why we exist. Obviously, the primary way we do that is by offering dental benefits that encourage people to get care and facilitate that. We also have our own philanthropic arm, which Holly oversees, that helps to ensure that even people who don't have dental coverage have access to oral health care services too. So I'll turn it over to Holly, and she's going to talk a little bit about what the Delta Dental Foundation does.
Thank you. So I get asked a lot about what is the work of the foundation. Basically, we do teeth. We are the only foundation in Michigan with an exclusive focus on oral health. And these are kind of the 3 ways we do this: our awareness to action, which is our advocacy efforts. So we're always advocating for populations that have issues with access to care. And we're always advocating for more dental clinics and ability to access care. Recently, we funded the Corktown Dental Clinic in Detroit, which is Michigan's first LGBTQ affirming clinic. We also advocate for things like fluoride in the water. I'm a resident of the city of Lansing. Every morning, I'm drinking a big glass of tap water, which is strengthening my teeth, because last year the foundation replaced the fluoridation system in the city of Lansing, and we fund a lot of fluoridation systems throughout the state. We also provide education, whether it's our own education, which is always free for all of our materials, our curriculum, our trainings, or we're providing scholarships to dental and hygiene schools. And then we provide funding. Last year, we provided $6.5 million worth of funding to over 300 grant partners one of which was MDHHS, which we provided $1.5 million in funding for the kindergarten oral health assessments. Why do we do that? Well, it's critically important that children start school ready to learn without pain. Michigan is a state that is not growing in population, so every child's success is absolutely critical to our future prosperity. Next slide, please. We also do a lot of work in the disabilities arena. Individuals with intellectual disabilities are those that struggle the most to find access to dental care. There's an average 2-year wait for an adult with an intellectual disability to see the dentist. In the Upper Peninsula, that wait is more 5 years. You may have attended our exhibition at Heritage Hall. We did a we did a photo exhibition of Michiganders with disabilities. The photos were taken by a world famous disabilities photographer who runs a nonprofit called Positive Exposure. We will be continuing that work with a photo shoot in the northern part of Michigan and the UP. And we also have a program called the Centers for Inclusive Dentistry throughout the state, where we train dental staff who work in nonprofit dental clinics and community health centers, send them for immersive training on how to treat patients with disabilities, give them the equipment that they need to do that. Up until 2019, dental schools and hygiene schools were not required to teach about disabilities. And so between that and patients often taking longer in the dental chair, we have a perfect storm of a critical need to improve access. On the commercial side, I'm extremely proud that the foundation worked with the Delta Dental corporate to expand our commercial benefits for those with disabilities. So on January 1st, 2022, we became the first dental benefits provider to greatly expand benefits. So this includes, on top of individual benefits that people get through their employer, this includes 4 hygiene visits a year, so 4 cleanings a year instead of 2, nitrous oxide, some anesthesia services, and the biggest, I think, successful part of these benefits is that we're actually paying the dentist more to see patients with disabilities. They can bill a behavior code for patients who take longer in the chair. This actually made national news. This was huge. This is not a charge, not a rider. This is completely at no cost to families, and we hope every dental insurance company will follow us, especially because children do not age out of this benefit. If they are permanently disabled, they will be on their parents' policy as long as that policy is in effect. Next slide, please. So soon you are going to be seeing, if you haven't already, our new mobile unit that we share with the corporate side. We have a 53-foot, 3-chair, brand new mobile unit that can do everything from screenings up to root canals. There's some pictures of some other mobile units we funded. I don't think there's a mobile unit operating, doing sealants or screenings or visits in Michigan that we haven't helped fund as far as dental mobile units. You see our logo on a lot of units. Locally, one of the programs we'll be doing with our mobile unit is collaborating with Child and Family Charities to bring University of Michigan dental students in to screen foster children who have been newly placed in the system. The state wants to see a dental visit within 90 days. That's really difficult to do with today's workforce shortages, so we'll be bringing the mobile unit in to do that. Next slide, please. We also do a lot of work with veterans. So I'm the daughter of a veteran. I have a son in the National Guard, and I have a son who's active duty deployed in Kuwait and Iraq right now. And until I took this job, I did not know that 92% of veterans are not covered by the VA for their dental care. The only way to be covered is to be permanently disabled or to have suffered a traumatic mouth injury during your active duty. We have a lot of veterans in this state and in every state who are suffering and cannot access dental care. We collaborate with the program, and we totally fund a program called Victors for Veterans at a University of Michigan. Victors for Veterans is for those individuals who need substantial amounts of dental care. Gary, the individual on the left, is one of the veterans, and you can see that Gary has a prosthetic leg. When I met Gary, I kind of assumed maybe he had lost his leg in, say, Vietnam. He's about the right age for that. But when I started to talk to him, I heard a story that could really happen to anybody. Gary had a good job with good dental benefits and great teeth. But when he was in his 50s, he was diagnosed with lymphoma, and he underwent radiation treatment. And the lymphoma kept coming back, and he underwent years of treatment, during which the radiation destroyed his teeth. And at the end of the treatment, he only had 8 teeth left, and those teeth were very painful. He had also lost his job, lost his house, and for a brief time was living out of his car. While he was undergoing all this, he was also diabetic. And because he could not eat the right foods, he could not keep his diabetes under control. So he's lost his leg to complications of diabetes because he couldn't get the dental care that he needed. That's why it's critically important that we're providing this care. And we're going to actually be announcing a formal partnership with Victors for Veterans, pledging that we are going to be a continued funder of that program because it is so important. Thank you.
So we would welcome any questions that you may have.
Yes, we have a couple questions. First of all, thank you for that your presentation. And I've been working with Delta Dental a lot, especially in my community where diabetes is running rampant. So I appreciate the work that you do when you come to Pontiac and how you serve our community. But now we're going to have a question from Representative Aragona.
Thank you, Madam Chair, and thanks, guys, for being here and for all the good work you're doing around the state. I know of Delta Dental of Michigan, but I didn't even realize that you guys are Midwest oriented. So just kind of a broad question: do you guys see in those states, or maybe even in other states, if you're tracking any of the dental initiatives or bills or anything that we could be aware of that other states are doing to maybe give them a competitive edge, or something we might want to take a look at here in this committee?
Thank you. Appreciate the question, Representative. There is some legislation that's been introduced in several states pertaining to dental loss ratios, and it is this is a slightly off topic, but you asked sort of what we're seeing in other states, and I feel compelled to point this out. Dental loss ratio is typically legislation that dictates how much a dental plan has to spend on claims or care versus administrative expenses. So the example I'll give you is if a dental plan collects $100 in premium, most of the dental loss ratio legislation says that it has to pay at least $83 for care, for claims, right? Reserving $17 for administrative expenses. Administrative expenses are everything else we do, right? It's the cost of operating our claims processing system, our eligibility system, our building for employees to work in, our quality improvement, our fraud, waste, and abuse detection systems, everything that we do operationally. So that sounds, on the surface, good, right? We all want, as purchasers, to have the vast majority of our healthcare premium being spent on care rather than administrative expenses. But you have to look a little deeper to understand the unintended impact of dental loss ratio legislation like that. And I recently came across some information from the Society of Actuaries, so a third-party examination of this issue. And a typical kind of mid-sized dental plan might have a dental loss ratio of about 70%. So in order to meet an 83% threshold, that dental plan would have to, there's a variety of things they can do. The most likely scenario is that they would have to cut their administrative expenses by 10%. They would have to increase their premiums by 38%. Okay, that's an important point. There's not much appetite in the marketplace for increases of 38%, especially as employers are facing lots of other expenses to attract and retain employees. And they would have to increase claims payments, which is really payments made to dentists, by 63%. So these are some massive increases that the market probably just won't bear. And as a result, you would find some employers, many employers, dropping dental coverage. The end result, if you go back in our presentation here, people losing dental coverage means they're a lot less likely to receive care, and their disease, their oral disease, is more likely to advance, worsen, affect their overall health. So sort of a long answer, Representative. I appreciate the question, but I would just point out that, you know, if you're approached about dental loss ratio legislation in Michigan, understand that it is a wolf in sheep's clothing. It has some very negative impacts on the availability and the affordability of dental coverage. And it is, thankfully, we've been happy to see that legislation fail in several states across the country. Unfortunately, it has advanced in some states too. So, and I would just point out too, believe me, our customers expect us to keep our administrative expenses reasonable, right? Every single day, they're pushing us to hold our administrative expenses in check and make sure the vast majority of their healthcare dollars are going towards care, not towards administrative expenses. And final point on this, you know, those administrative expenses or administrative costs fund important things, right? They help fund quality improvement. If we need to make an investment in our IT system to operate more efficiently so that in the future we can minimize our administrative expenses, then that might be an investment well made. But that investment counts against us in our dental loss ratio. So, and it, you know, no one wants to sit on hold with customer service, but if you have to reduce your expenses, you may have to reduce your number of customer service agents. So it has some very negative impacts. But thank you.
Thank you. There's several more. Representative Breen.
Thank you, Madam Chair, and thank you, Delta Dental. I'm familiar with some of the foundation work. We all love the March's Reading Month help you give us. The foundation work, the kindergarten screening, it's all fantastic. So I almost feel bad because I'm asking you about one more thing. My son was born with a cleft palate. For people who don't know, babies with cleft palates, it affects how they eat, how they sleep, how they breathe. If you're the mom of a newborn, you don't sleep as it is, but the baby has to sleep upright until surgery can be done. Otherwise, they will die in their sleep. So you really just don't sleep. I'm wondering, with all the advocacy work that you do you do anything with people who have craniofacial disorders, like cleft palates?
Yeah, we do. So we funded, not specifically in Michigan, but in Ohio. They've done quite a lot of work through Ohio Cincinnati Children's, and we funded that. Through the University of Michigan, we have funded their disabilities clinic, which should be opening very soon. And they already have a craniofacial clinic there, but some of those children, once they become adults, will be now seen in the Delta Dental Clinic at the University of Michigan. However, and this is what I always say to people, please bring us anything that needs to be done. This is what we do. And if there's a group that we can work with, if there's an issue that we can advocate for, that is our whole purpose. So please have somebody contact me.
All right. Well, and if you have anything regarding craniofacial disorders, I would love to be looped in.
Yep,
Thank you.
absolutely.
Thank you. Vice Chair McFall.
Thank you, Chair. So I don't have much of a question. It's more of a statement. I really appreciate the work that you guys do with Corktown Health. They're not in my district, but they're actually opening a second location in Hazel Park, which is in my district. They're about ready to break ground. So I'm really hoping that you guys can help them with some dental chairs there as well.
So I will say this. Technically, I have a board who is supposed to approve, our funding. But they're a great board. I've already talked to Anthony, the CEO, who we work very closely together, and he said they put in 3 chairs at Corktown. He said we're doing 6 chairs in Hazel Park, and I said, we're going to fund that, right, Anthony? And he said, that's what I assumed. We're going to fund that. The work they do there is so necessary. We were also able to link Corktown with a researcher at Indiana University School of Dentistry who actually did a 3-state survey of LGBTQ patients and unfortunately determined what we all kind of knew, and that's that this affirming care is extremely well needed. We also need to train our dental students, and Corktown will be a location where dental students will be, and Hazel Park, where dental students can come and understand how to give competent care to this population.
Well, I really appreciate all of that work because Hazel Park is perfectly situated. We're right at where Wayne County, Macomb County, and Oakland County meet. So we'll be able to cover a broad range of residents. So I appreciate it.
Thank you. I'm really excited about it.
Thank you. Representative Bruck.
Thank you, Chair. Thank you for being here. I do want to say I grew up going to a dentist that did not believe in anesthesia, and I had my front teeth pulled out as a child and had nightmares for decades. I do appreciate you pointing out that the veteran deal, most people do not realize you have to be 100% disabled in order to get care through the VA. A question, though, I have is there anything at the state level that we can do to help? What do you see as either A, your biggest hindrance in getting coverage to people, or B, what could the state do that could be helpful to you to get care for people with dental? And just a side note, I don't know if it's true on WJR that the lady with the crackly voice that always talks about health care and heart care, and if you have germs in your mouth, you have heart problems essentially, or heart problems. But just a side question on that. Thank you.
Did you want to handle that, or you take
I'll
first
start.
shot at that?
Yeah, thank you, Representative. So my sense is, and Holly may correct me if I've got this wrong, but my sense is that really, for the most part, all health coverage for veterans flows through the VA, right? So, and that's, of course, a federal system. So I think probably for the state to be most helpful, we need to look at how do we bolster community clinics, the safety net clinics throughout the state to ensure that they can treat the volume of patients, the volume of veterans who need care. And certainly the foundation that Holly runs is helping to do that. There may be ways in which the state can add to that, add resources to that.
Yeah, and just a clarification, I didn't mean care just for veterans, but as far as your coverage of getting people in the state to get that preventative care.
Oh, yeah.
Sorry.
I think it's an open question, and an important one. But I think maybe we need to explore some sort of unique benefit for the veteran, for veterans who don't have coverage elsewhere. So I don't have a great answer off the top of my head, but I think it's an issue that we could dive into and maybe partner with you on. Do you want to anything to add?
Yeah. First of all, your radio person is correct. If you have an overabundance of either periodontal gum disease, bacteria in your mouth, or bacteria from dental decay, yes, it is impacting your entire body, your heart, hardening of the arteries. Alzheimer's is linked to that. So dental care is pretty critical. If you look at the population who can't access dental care, it is by and large financial. It is a financial reason. And the expansion of Medicaid and the increasing the payments to Medicaid that the state did this year is amazing and wonderful. But there are some populations that probably need some extra benefits and some different benefits and a different payment system. Those with intellectual disabilities are one of them. But as Rick said, if we can just increase general access to our public health clinics, our federally qualified clinics, our nonprofit clinics, that is where people are trying to get care who don't have dental benefits and who can't afford care. So the more we make those clinics accessible and well-funded, the better off our entire population is.
I would just add to that, Representative, you know, it's not like every health clinic in this state has dental care, right? Lots of health clinics just don't have the capacity today or the staff to deliver dental care. So to the degree we can help those health clinics add a dental component, will improve access to care for everyone who doesn't have dental coverage.
Representative Stone.
Thank you for your testimony. I have a few very impassioned dentists who are advocates, especially for providing care for individuals with disabilities and developmental disabilities. And often when we think of dental care, we don't think of hospitals and access to surgical suites, but really they have been outspoken advocates on some of the challenges they have providing specialized care to those patients. Can you speak a little bit to the challenge of access?
Yeah. Thank you, Representative. Very good question, very timely issue. We've seen a decrease in availability of operating rooms in hospitals and ambulatory surgery centers in recent years for dental treatment. The good news is the state recently increased the reimbursement available to those hospitals if they'll make space available for dental treatment. So there's been a big positive step forward to help those hospitals cover the cost of making their operating rooms and ambulatory surgery centers available for dental treatment. I don't have any recent data to know if that has completely solved the problem. I doubt it, but I think it has probably put a dent in it. But there may well be more work to do. But you're absolutely right. The dentists that are talking to you about that are right. It's been a struggle. And it's difficult to treat a patient in a hospital setting in the first place. It takes extra time and a lot of extra effort. So to have that capacity go away or shrink is really hurting those patients who need care in that setting. So we may have some more work to do on that.
I have a question.
Madam Chair.
In the past, Michigan's had many dentists who worked on our senior population who are on Medicaid spend downs or in nursing homes. Today, it can take months to get this vulnerable population the care that they need. Do you have any policy suggestions that we could reinvigorate, to help this the dwindling population of dentists who serve these seniors? And this is really, really a question I'm deeply concerned with, because I do have a sister that's in a nursing home. And as you have stated over and over again, that disease and bacteria in your mouth could affect their health. So the question is, do you have any suggestions, policy suggestions, that we can implement that could help this population of people?
I'll start, and Holly, feel free to jump in, but two things come to mind policy-wise. Again, there's good news here. The state, with the legislature's appropriation, made a significant investment in the Medicaid dental program to increase reimbursement, which hopefully attracts more dentists to treat the Medicaid population. That is still very new. That increased reimbursement just took effect April 1, so it hasn't had enough time to really to determine how much impact it's going to have. But we're optimistic, and I think a lot of other oral health stakeholders are optimistic that there will be more dentists available to treat that population because they're finally getting reimbursed at a level where they don't lose money every time they treat a Medicaid patient. So that may help. The second item is not a policy item necessarily, but it goes back to what Holly shared about mobile units and innovative ways to deliver care to people where they are, rather than expecting them to come to a health clinic or a dental office or something like that. So I don't know that there are any silver bullet policy solutions, but ensuring that care is more available, maybe some investments in the system to make care more available is going to make a difference.
Yeah. And to tag on to what Rick said about innovation, the vast majority of the care that people in communal settings need is not from a dentist. It can be done by a hygienist. So bringing hygienists in mobile units, if there's any policy change to make it easier for hygienists to see people in those settings, that could be very beneficial. The beautiful part about hygienists is they cost way less than dentists. And the reality is that really is the majority of what needs to be done, is keeping that mouth clean and training the people on site of how to keep people's mouth healthy.
Very good point. Two areas that I heard today that we definitely will take in consideration, the one being with our veterans and the other one being with our seniors. So any further questions from the committee? Representative Markkinen.
Thank you, Madam Chair. I represent the Western UP, and I would just advocate and beg you to, when you do take your mobile unit up to the UP, come all the way to Ironwood,
So, yeah.
not just Marquette.
Yeah, I know. So one of the things I did when I was very first with the foundation was advocated to have the Wisconsin clinics accepted into Michigan Medicaid.
That'd be wonderful.
And they are, by and large. We have been able to do that to get them approved by Michigan Medicaid, because in that part of the UP, you're closer to Wisconsin than you are to Michigan,
Right.
to any clinics in Michigan. But 100% agree with you. There are big issues with dental in the UP. We have a lot of dentists who are retiring who cannot sell their practices in the UP, so they're closing them down, which is just creating more issues of access. Yeah, and that, I think, is definitely, and some of the ways that it's potential that the state could work with that is increased loan forgiveness for dentists who practice in the UP, or assistance with purchasing or establishing dental practices in the UP. It is a huge problem.
It is. Thank you.
Yeah.
Thank you. Any other questions? Well, hearing none, thank you so very much for your presentation. Extremely informative. A lot of good thought process, provoking ideas here that we can potentially implement. So, thank you.
Thank you.
Thank you very much for your time.
You're so welcome. Well, next today on our agenda is the vote on House Bill 4595, for which we heard testimony Tuesday. There's no cards to read in, so I entertain a motion to report House Bill 4595 with recommendation. Rep. Scott? Representative Scott moves to report. Mr. Clerk, will you please call the roll?
Representatives Carter?
Yes.
McFall?
Yes.
Coleman?
Yes.
Stone?
Yes.
Breen? Rogers?
Yes.
Scott?
Yes.
Young?
Yes.
Fitzgerald?
Yes.
Grant?
Yes.
Harris?
Yes.
Markkinen?
Yes.
Zot? Aragona?
Yes.
Brock?
Yay.
Nyer?
Yes.
Smith?
Yes.
Madam Chair, you have 16 yeas, 0 nays, 0 pass.
Thank you. Let me see, I missed one. Hearing no objections, that's the minutes. Excuse me. House Bill 4595 is reported with recommendation. Thank you on that. Next on our agenda is a vote on House Bill 4704. No cards to read in. We need a motion to report House Bill 4704 with recommendation. Rep. Buck moves to report. Mr. Clerk, will you please call the roll?
Representatives Carter,
Yes.
McFall,
Yes.
Coleman,
Yes.
Stone,
Pass.
Breen,
Aye.
Rogers,
Yes.
Scott,
Yes.
Young,
Yes.
Fitzgerald,
Yes.
Grant,
Yes.
Harris,
Yes.
Markkinen,
Yes.
Bazat, Aragona,
Yes.
Brock,
Yay.
Nyer,
Yes.
Smith.
Yes.
Madam Chair, you have 15 yeas, 0 nays, 1 pass.
Thank you. House Bill 4704 is reported with recommendation. Next on the agenda are votes for House Bill 4732 and 4733. There are no cards to read in, so we need a motion to report House Bill 4732 with recommendation. Rep. Aragona moves to report. Mr. Clerk, would you please call the roll?
Representatives Carter,
Yes.
McFall,
Yes.
Coleman,
Yes.
Stone,
Yes.
Breen,
Aye.
Rogers,
Yes.
Scott,
Yes.
Young,
Yes.
Fitzgerald,
Yes.
Grant,
Yes.
Harris,
Yes.
Markkinen,
Yes.
Bazat, Aragona,
Yes.
Brock,
Yay.
Nyer,
Yes.
Smith.
Yes.
Madam Chair, you have 16 yeas, 0 nays, 0 pass.
Thank you. House Bill 4732 is reported with recommendation. Now we need a motion to report House Bill 4733 with recommendation. Rep. Fitzgerald moves to report. Mr. Clerk, would you please call the roll?
Representatives Carter,
Yes.
McFall,
Yes.
Coleman,
Yes.
Stone,
Yes.
Breen,
Aye.
Rogers,
Yes.
Scott,
Yes.
Young,
Yes.
Fitzgerald,
Yes.
Grant,
Yes.
Harris,
Yes.
Markkinen,
Yes.
Bazat, Aragona,
Yes.
Brock,
Yay.
Nyer,
Yes.
Smith.
Yes.
Madam Chair, you have 16 yeas, 0 nays, 0 pass.
Thank you. House Bill 4733 is reported with recommendation. Now we need a motion to excuse Representative Bazat from today's meeting. Representative Markkinen moves to excuse Representative Bazat from today's committee meeting. Hearing no objections, Representative Bazat is excused. Well, seeing no further business before this committee, I can't say we should meet again next week, should I? But anyway, I will entertain a motion to adjourn. Representative McFall, Vice Chair McFall moves to adjourn. Hearing no objections, the committee is adjourned.